Hi, everyone. My name is Leigh Andrews, and I'm a doctoral student uh, from the University of Delaware. I'm also an extern and a therapist at the Jefferson Center City Clinic for behavioral medicine under the supervision of Dr. Virginia O'Hare. And I'm here today to do a short little talk on mental health for healthcare providers in and during the COVID-19 pandemic. Um, this is going to be about committed action in particular, and it's coming from myself and my fellow doctoral student and extern from LaSalle University, Brooke, Liberto. All right, so committed action. Um, what can I expect to learn? Well, first, we're going to try to identify actions that you want to commit to, and then we're going to think about how to stay on course when things get hard, as they're going to get. It's also going to be about learning how to continue to take actions consistent with your values in your day-to-day life, day in and day out. So what is committed action, right? What does that mean when we actually boil it down and break it into pieces? On some level, what that means is that it's a lot easier to drink water when you have a glass. So if you're thirsty, you need to drink water, you need to keep yourself alive, put water in your body. That's a very vague goal. And without a glass or a bowl or a cup, it's pretty hard to do. I mean, you can lap water out of a stream, like, a lion in a river or a hippopotamus. You can, drink water out of a tap. You can put your mouth under it and not very hygienic. These are all possible. But when you break it down and actually get the tools you need and move towards it, the easiest way to actually drink water and accomplish what you need is to have a glass. Kind of goes without saying, right? That's a really important thing to keep in mind when we think about taking effective action that are guided by our values. So in that case, it's sort of a silly one, right? Drinking water, making sure that we're hydrated. But whatever our values might be, as healthcare providers, we're often committed to, helping other people, to helping our communities, to preserving human life. But these values could be different. They could be about scientific inquiry. They could be about, the good of the hospital. They could be about sort of meeting your own needs, trying to maintain your own um, needs and your family's well-being. Whatever values we have, in order to take effective action, we need to make sure these are kind of smart goals. They're broken down into pieces. So just like we need a glass to actually be able to drink that water, our goals need to be specific, measurable, adaptive, realistic, and time framed. They can't be nebulous. They can't spread out over a year. So let's say it's a goal that's sort of about your value is education, right? You're a medical student or a teacher who's teaching, a medical school teacher who's working with students to help them become doctors. You probably already know that if your goal is to either become or produce the most effective doctors and the most effective practitioners, the most effective nurses and social workers, it's not enough for that to just be your value and for that goal to be that they turn out well. It has to be more specific. It has to be more measurable as well. So it might be that if you're teaching students how to sew stitches, they can learn how to sew stitches for a specific type of injury, that you can measure it, that they can do it quickly in a certain amount of time, or that they can do it to a certain degree of kind of closeness and fineness for the stitch. You got to be adaptive as well. So if it turns out like now that you're not going to be able to teach people in person, you have to teach people remotely. Maybe being adaptive means finding ways for people to practice this at home, encouraging students to practice it using something that is sort of more adaptive at home, maybe using a needle and thread. Your goals also have to be realistic. It's not enough to say, well, my students are at home, I want them to learn how to transplant a kidney, or I want to have all the materials we need to make sure that no one gets hurt or no one loses their life in this sort of tragic pandemic. But it may be that as much as we want that to be the situation, it's not a realistic goal. And that a realistic goal is to say, I'm going to make sure that my department is as prepared as it can be. That I'm going to make sure my students are as taken care of as they can be. That I'm going to make sure my patients get the best care that I can provide them, given the circumstances. And lastly, making sure these goals are time framed is extremely important. One way to think about this is during these times ahead, as things are going to get harder and harder, busier and busier, you're going to get called in day after day, and it's going to be increasingly complicated and difficult and stressful. And instead of having these goals of, I want to make sure that during this period, I live up to the best of my values, sometimes it can just be about saying, today when I'm on the ward today, when I'm in the unit today, when I'm there with my colleagues and everyone and my patients, I am going to do X, Y, and Z, something specific and small, and I'm going to do it today in this broken down time period. I'm going to be as kind to my patients as I can. I'm going to be as um, supportive to my colleagues as I can be. I'm going to either take on whatever extra work I might be able to take on, or ask for help. Say, I need support and I need that space. Um, the goal of these committed actions is all about increasing our success, but it's also about anticipating obstacles. There are going to be internal obstacles. If I can't do this, I can't live up to this, it's getting too hard. And there are certainly going to be external ones as well, limitations of resources, limitations of support, just limitations of sort of things that we can't control or deal with. It's important to think about these obstacles in advance so that when they come up, they're not a surprise and we're able to, thinking back to the SMART goals, adapt and still find ways to take steps towards our values, even when there are obstacles. Maybe you don't have the resources you need to provide the care that you want to provide, but perhaps there are still ways for you to take a step towards that value of supporting human life and of protecting your patients. Maybe there's still something you can do, even if it's not about getting more materials, but it's just about being as kind and present with your patients as possible. It's also important to consider the cost of not taking these steps. So it can be easy to sort of think, I just can't do that. It's too hard. These steps, I don't have the resources. But sometimes the emotional and physical cost of avoiding something, of doing nothing, or of not taking a step forward can be as great or greater than the perceived obstacles. So it may be that if you don't reach out and support your colleagues, which seems like it's just going to take too much off your own resources when you most need them for yourself, it could be that there's actually an emotional cost to that separation or a physical cost to that lack of reciprocal support, and that actually reaching out to those colleagues, taking that step to support your community, paid off in more ways than you expected. And lastly, you also have to be sort of wise here and understand that you're going to drift. You're not always going to successfully take these steps, or you're going to try to take them and make these small committed actions, and it's not going to be enough. And it's important to have self-compassion, to be kind to yourself, to understand you're doing the best you can, and to practice radical acceptance. There's another talk on that, but basically to accept the things you cannot change and to understand that you have to be accepting sort of what can't be shaped. It is human nature to resist change. It's the nature of systems to resist change, but it doesn't mean it's not worth taking small steps day by day in pursuit of our goals and values. And taking this action can help you grow too. It can help you to see the kind of person you are and that you want to be. Even the smallest action can really change a situation. It's taking a step in the right direction, staying true to our values. One way to think about this is if our value is to move west, right? We're trying to get sort of towards that setting sun. Doesn't mean you have to walk 100 miles a day. It means that you have to take a step in that direction each and every day. You have to pursue that direction to the best that you can, knowing that you might not be able to cover as much ground as you want to. And taking that action can also be grounding. It can be a reminder of what we can and cannot change. It can be a reminder of our limitations and our strengths. And of course, not all of our actions will be successful. We have to be kind to ourselves. We have to be aware that these are difficult times and there's only so much that we can do. That's neither a reason not to try to the best of our capabilities to live up to our values, nor is it a reason to give up. We just have to do the best that we can. Thank you so much for listening to this sort of brief segment on committed actions. There are additional resources, so the links here sort of have a little more information about this principle. There's also materials on managing healthcare workers' stress, how to face COVID, stuff from navigating this mental health crisis, coping with anger, and understanding compassion fatigue. So I encourage you to explore these and give these a try. And lastly, don't forget, or second to last, don't forget, there's the Suicide Prevention Lifeline, the National Alliance on Mental Illness for Philadelphia, and nationally, you can always reach out and talk to someone. And if you want a Jefferson-specific resource, the Center City Clinic for Behavioral Medicine and the Department of Psychiatry and Human Behavior has a weekly group on Mondays and Thursdays online at 3 p.m. for healthcare providers who need support. Thank you so much for your time, and thinking of all of us in this really difficult era. And I hope that this provides some of what you need, and that if you feel like you need more, you're willing to reach out to us. So again, my name is Leigh, and I want to give thanks to my colleague Brooke and my supervisor, Dr. O'Hara. Thank you so much.